If you are watching this video, your doctor has discussed the potential need for an implantable cardioverter defibrillator, or ICD. To address your heart condition, we will be discussing what implantable cardioverter defibrillators are, why you may need one, what to expect if you're going through surgery, and any potential risks or lifestyle changes. What is an ICD? An ICD is a battery-powered device that is surgically implanted under the skin of the chest that will monitor the patient's heart rate. The ICD is connected to the heart with wires that are called leads. A healthy heart has a heart rhythm that is paced to give the body the correct amount of blood flow. This normal heart rhythm can be seen here. If the heart experiences arrhythmia, abnormal rapid heart rhythms will occur, which can be seen here. These chaotic beats can happen without warning. A person is likely to die from this condition if not treated immediately. This is called sudden cardiac death. The purpose of the ICD is to prevent this from happening. The ICD will detect abnormal beats, send electrical signals to the heart, and stop the arrhythmia. The quick response time of the ICD will enable people with ventricular tachycardia or fibrillation to survive sudden attacks. The ICD device both monitors your heart rate and provides the necessary corrective electrical signals to the heart. ICDs are capable of producing a variety of signals to address your specific cardiac irregularities. ICDs are implanted just beneath the skin in order to make the surgery less invasive. The electrical signals travel to the heart through leads that go through the subclavian vein. The signals provide an impulse of current to override and restore proper biological functioning. The device can prevent sudden death in patients with a history of ventricular tachycardia or other life-threatening irregularities. An ICD is comprised of two external components, the leads and the casing. Leads are wires that are attached to the inside of the heart. Leads are capable of both sending signals about the heart's condition and conducting the corrective impulse. Inside the casing is a detection system called the pulse generator that is always recording what is electrically happening in your heart. The pulse generator allows the proper amount of current to travel through the leads to the cardiac tissue. Based on the signals it picks up, it will determine if a pulse is necessary, and if so, which type. The battery takes up a significant portion of the device. Your device will always be running, so the battery is critical to the device's long-term success. Patients that need an ICD may have the following conditions. First, ventricular arrhythmia is when there are fast, slow, or chaotic contractions in the ventricle. This condition is dangerous because the ventricle cannot properly pump enough blood to the rest of the body. Next, someone with a high likelihood of a heart attack or cardiac arrest may be prescribed ICD to keep their heart beating in case of failure. Long QT syndrome is a condition which affects repolarization of the heart after a heartbeat. If the heart cannot effectively polarize, then the heart cannot contract. Brugada syndrome is a genetic condition that results in abnormal electrical activity within the heart, increasing the risk of sudden cardiac arrest. Finally, patients with congenital heart disease, which is any type of abnormality of the heart present at birth, may require an ICD.
An ICD can generate different types of shocks for different cardiac situations. The pulse generator will send an electrical signal capable of defibrillation during cardiac arrest. This restarts the heart when the patient has no pulse. The sensation is painful but brief and can save your life. When the leads sense the heart is still beating sufficiently but improperly, the ICD will send an impulse to induce cardioversion. Cardioversion resets the heart under less serious arrhythmias, such as atrial tachycardia, where the patient has a rapidly contracting atrium. ICDs are also capable of pacing the heart by generating consistent low pulse signals to stimulate the heart to beat in a more regular manner. This is effective for both rapidly beating hearts, a condition known as tachycardia, and slowly paced hearts, a condition known as bradycardia. As shown above, improper firing of the sinus node will result in one of these two conditions. The sinus node is the first signal of the heart to beat, so its effectiveness is key. The ICD will act in place of the sinus node to facilitate proper timing. Before surgery, please inform your doctor of any medications you may be taking. Blood clotting medications in particular could lead to serious complications, such as vessel blockage during lead placement. You may not eat or drink 24 hours prior to surgery because complications can occur by food in the stomach during the administration of anesthesia. If a patient vomits during surgery, there is a chance it will be inhaled into the lungs. Post-operative nausea and vomiting can also be prevented by having an empty stomach at the beginning of surgery. General or local anesthetic may be used for this operation. Please tell your doctor if you have had trouble with anesthetics in the past so they can select the right method for you. Once you have received an anesthetic, an incision is made near the left collarbone in the subclavian vein, as shown in the diagram below. With the help of an X-ray imaging technique known as fluoroscopy, the surgeon can see inside patients to guide leads down into the heart. Depending on your needs, the appropriate amount of leads will be attached into the cardiac tissue with fixation screws. Once the leads are in place, they are attached to the pulse generator housing. The housing is then placed in the initial incision site just underneath the skin, beneath the collarbone. After the ICD surgery is complete, you will spend 1 to 2 days in hospital recovery. This will depend on how well the surgery went, your age, health, and other related factors. A monitoring period will be conducted in order to make sure your heartbeat is regular and the device is working properly. Your doctor will calibrate your ICD to your specific anatomy and test it once implanted to make sure the strength of the pulses are appropriate. You will be fully recovered after a period of 4 to 6 weeks. Immediately after and in the ensuing weeks, you will experience some pain, swelling, and tenderness after surgery. Use over-the-counter medication for pain management. When going into surgery, there are always risks that may occur. The main risk from the ICD device itself is from a malfunction in the electrical pulses. Pulses that are not needed may occur if the wires are damaged from complications during surgery. Also, a very fast heart rate due to extreme physical activity may cause unwanted pulses to occur. Not taking the required medication prescribed from your doctor will cause errors in the system. Your doctor can reprogram the ICD or prescribe medication to stop or lessen the unnecessary pulses. Risks involved during the surgery include swelling, bruising, or infection. Internal bleeding may occur if something was unintentionally cut. Blood vessel, heart, nerve, and lung damage may occur. You could have an allergic reaction to the material of the ICD or other tools used in the surgery. Finally, fluid buildup around the heart can cause the heart to work poorly. Your lifestyle will change after the ICD surgery in several ways. First, you'll have to avoid prolonged contact with devices that can interfere with an ICD. These devices include cell phones, household appliances, high-tension wires, metal detectors, industrial welders, and electrical generators. These devices can disrupt the electrical signaling of the ICD and prevent it from working well. You may not be able to tell whether the ICD has been affected or not, so it is a good idea to keep the device away from these situations. Some procedures that can interfere with an ICD include magnetic resonance imaging, or MRI, shockwave lithotripsy for kidney stones, and electrocauterization to stop bleeding during surgery. Let all of your doctors, dentists, and medical technicians know that you have an ICD. Doctors can give out a card that states what kind of ICD you have. Your daily activities will be minimally affected. You should resume normal exercise schedules without participating in contact sports because of the damage they can cause an ICD. Also, driving should be avoided if you have fainted in the past 6 months. Once fully recovered, you will have a small incision scar. The ICD will appear raised underneath the skin, as shown. ICDs can be coded from outside of the body, so any future alterations due to a change in health status would not require surgery. Also, after 5 to 7 years, the ICD batteries must be replaced. The doctor will replace the generator along with the battery before the battery begins to run down. Replacing the generator or battery is a minimally invasive surgery. The wires of the ICD will also need to be replaced eventually. Your doctor can tell you whether the ICD or its wires need to be replaced. Implantable Cardioverter defibrillators are an incredible piece of technology that constantly monitors your condition. For those with serious heart conditions, ICDs can and probably will save your life. However, your lifestyle will have to be adjusted, and there are serious risks associated with the procedure. Please weigh the benefits and risks of such an operation carefully with your doctor before deciding if an ICD is right for you.